since we're talking about hepatitis, can you share a global status of viral hepatitis, particularly in India, and its impact on public health? What are the most critical action needed to combat viral hepatitis effectively? Like we talked, you said the vaccination, immunization is required. And because we're talking about, for this year's theme is time to take action. Time to take action against hepatitis to protect our world.
Yes, hepatitis, 96% of the deaths, of the 1.3 million deaths which occur due to hepatitis B and C, of all the hepatitis deaths, 96% are because of hepatitis B and C. Let me tell you an important part. The blood-borne viruses B and C are chronic infections. Chronic means body cannot clear them. Hepatitis A and E, they are cleared by body, but B and C and D, they persist for your life unless treated. Hepatitis B, the treatment is to suppress the virus. Clearance is rare, like in HIV. So in hepatitis B, if you give the drug, it will suppress the virus, but if your virus is suppressed, you are as good as anybody. And we therefore need to differentiate infected from diseased patients. So 30 million are infected, but the disease will occur in 1 to 10% of them. But the mindset of the remaining is so bad that they feel that, oh, something has happened. I got 2 patient subjects yesterday. One was 32 years, a lady, and one was a boy who was 37. Both had not married because they thought they are sick. So it is so important for us to say we have so many infections. So having an infection is not equivalent to disease. जैसे घर में चोर आ जाए और चोरी ना करे, सोफे के नीचे बैठा रहे, भाई चोरी नहीं करनी तूने, मेरा नुकसान नहीं करना, मुझे मारना नहीं, मेरे रुपए पैसे मत ले जाना. बट सपोज ले भी जाता है रुपए पैसे तो इंश्योरेंस से मिल जाते हैं, मीन्स दवाइयाँ हैं, इलाज है. तो लोग बाग जो ये सोचते हैं, तो आई वुड से फॉर हेपेटाइटिस बी एंड सी, फॉर पॉलिसी मैटर्स, हेपेटाइटिस सी इज ट्रीटेड बाय ड्रग्स. वी हैव वेरी इफेक्टिव ड्रग्स. दे कैन cure you of the hepatitis C in about 12 weeks time. They are oral drugs. You take a pill a day for 3 months, finished. And 90-95% clearance. If you have hepatitis C and if you get the drugs, then chances of cirrhosis, liver cancer, all of them decrease. And good part is India has a national viral hepatitis control program from 2018. Now it will be 6 years. And Nadda Sahab had launched it at that time, and it is free. Hepatitis C drugs are free. Very few countries in the world have this privilege for patients. The testing is free, the treatment, monitoring, everything is free. So if you know of somebody who has hepatitis C, please help them. For hepatitis B, the treatment is effective. You take a pill a day. The yearly cost may not be more than 4,000 rupees or so, and the virus is suppressed. Then you are as good as anybody. The risk of cirrhosis, the risk of liver cancer significantly decreases. So what we need to do is to take it in your hands. Don't depend always on doctors or on the governments or policies. Decide, if I have hepatitis B, I must get rid of it. If not, get the virus suppressed. If I have hepatitis C, I will get it cured because they are effective drugs. I will not have my body go to the stage of cirrhosis or cancer. And even if it occurs, you have transplant, you have every possibility. So the deaths can be reduced but by awareness. But if you are late, then like blood vomit or jaundice and others, then it is a different situation. Now the next part of your thing is about the policies. I think India is amongst the very few countries, despite being so large, is to have a powerful national viral hepatitis control program, but it needs to be more, visible. Like my desire is, like the Prime Minister sometimes says for TB, The number of deaths due to hepatitis B are no less, maybe more. In fact, the WHO says every 30 seconds there is a person who is dying due to hepatitis B. So like in last 20 minutes, 40 people have died due to hepatitis B somewhere in the world. And the number of deaths due to hepatitis B are not less than combined deaths by TB and malaria. So you put TB and malaria where we have more visibility. Why not more visibility, more awareness like your campaign for hepatitis B and trying to eliminate it, and also the empathy to support them is absolutely necessary. We have to eliminate, we just don't have to control, we have to get rid of it.
We have to do that, sir. And sir, like you mentioned how Prime Minister emphasizes on TB, and more than that, more deaths happens because of hepatitis. So I think I was very small, I still remember that people got more of awareness about TB. In fact, of when I was 7, 8 or 10 years around, I got to know about TB. How? Because of a public advertisement. Mr. Amitabh Bachchan was into a public awareness campaign advertisement in which he talked about TB, how it is transmitted, what are the solutions we have and stuff like that. I think these kind of strong campaigns we need for hepatitis as well, that can raise awareness on this and can make more aware people about this.
Absolutely.
And as doctors like you we have in our country, that is great. But more than that, I believe people watch more of actors.
Yes.
And then they make impact on people.
And you got the right person. Amitabh Bachchan has hepatitis B.
Exactly.
And he did a campaign once or twice. So will you go to him and tell him again? You go to Amitabh Bachchan ji and then say, sir, one more time and every time, and be with people. Let us see the elimination part. In case he is hearing or has some approach on this video, I think he is one of the best known persons, and his voice would make a difference.
Truly so.
Thank you.
So we also talked about National Viral Hepatitis Control Program. Along with that, I want to know views on that and how far it has progressed and what necessary steps needs to be taken to combat hepatitis to achieve country-wide elimination of hepatitis C by 2030, which the program aims for. And how can healthcare system and government better prioritize hepatitis prevention, screening and treatment, especially in resource-oriented constrained settings?
Well, hepatitis C, I think the government did everything. They provided the drugs. I know that they have not been adequately used by people. The screening, the virus, the RNA, everything is free. What is lacking is the public participation.
Yeah.
What is lacking is we hardly have 10 to 15% of the infected. India has 7 million, 70 lakh ka estimate hai, and we have hardly treated maybe few lakhs. So I would like to say that the testing, the knowledge about hepatitis C is very important. All those who got vaccination like smallpox and others, all diabetics who get injections, all those who are repeatedly using drugs, IV drug users, and they share their needles and syringes, all that group must be tested. I already told you that hepatitis C testing should also be done in those with dialysis, those who got blood transfusion before 99 or maybe even 2005. Till then the blood banks were not very effective, our testings were not. So I would say this is called recall. Then all blood banks who find anybody positive for B and C should inform the person that please come and get tested. All these are part of the viral hepatitis control program, but the public participation for that needs to be energized, and through interviews like you, Simran, it will make a difference. For hepatitis B, I already told you high risk groups. So ensure, if you are listening this, ensure if your friends are probably susceptible, pass this message. Each one of you, please listen and educate 10, and that person should educate another 10. And all the schools should have a competition maybe for a week. Yesterday we had a competition here, almost 200 students participated. You will be amazed their knowledge. They knew all about WHO guidelines of 2024. A 6th class student made a Rubik puzzle using Rubik cubes on hepatitis. So what I'm saying is, each one of you who is listening, go down to the school levels and don't be scared. Hepatitis B and C, they don't come by eating together or shaking hands and all that, so don't be scared, get treated. Body fluids, one must remember, like if you are infected, sometimes saliva has lot of hepatitis B, not C too much, or if you have an injury and you are positive, it is. And any doctor who is hepatitis B should definitely disclose to the patient or get virus negative before he can transmit the virus. So these are some of the tips that I have given you. The viral hepatitis control program in India has been somewhat, it was our own ILBS was lucky to be as a WHO center to help in the conception to creation, and now we feel that the government has done very well, but the public participation, awareness, the stigma, they are the bigger blocks and we have to overcome. We started a program called WOMB. WOMB is women who are hepatitis B positive. Women who are positive become the ambassadors. Suppose I am a woman and I am hepatitis B positive. I would not go and tell my husband the baby is born. I'm so scared, because you go for antenatal checkup in a clinic and they say you're hepatitis B positive. Now this woman cannot go home. She is so scared. यार घर जाऊंगी मेरा husband कहेगा ये तो गड़बड़ है. Such women, those who have survived all this, then we have been running it for almost now 20 years, this program, and these women are made as an ambassador. 100, 200 of them will go and say, don't worry, this is not your problem. But if you are talking to everyone, you may save many, many more, and their family lives can improve. So it is a whole of society approach. The infection is deadly, the infection is problematic, the infection is a cause of concern, but if we are standing together and our message is clear.
I think so they are the best people to spread message, because they have experienced it, they have
gone through it, and they have lived the agony, they have lived the despair, the isolation. We have a study called Beat B. How do you beat hepatitis B? Because people come and doctors say, no, you come after 1 year because you are not fit to take treatments. I am trying to get the guidelines changed, because you ask the agony of the patient, his isolation, he can't sleep, उसको रात को सपने में वायरस दिखता है, पर ऐसा नहीं होता दोस्तों. हेपेटाइटिस बी इज़ ए DNA वायरस, साइलेंटली रहता है. आपने टेस्ट करा लिया और आप बराबर उसका इलाज करा सकते हैं, वायरस को सप्रेस कर सकते हैं. बिल्कुल नहीं घबराना. एंड अगर डिजीज़ है तो डिजीज़ का ट्रीटमेंट, लिवर का ट्रीटमेंट, और अगर वायरस है तो उसको सप्रेस करके रखना. एंड इट इज़ गॉन, एंड यू हैव ए स्ट्रॉन्ग माइंड. ऑल दोज हैव नॉट मैरिड, फाइंड someone. If the likely spouse has any issues, doctors like me will solve this problem, but get married in 24. Latest by 25.
Okay. Great.
Okay.
So since we're talking about suppressing the hepatitis, and we talked about all the types of hepatitis we have, A, B, C, D and E. So I have few questions regarding vaccinations. One, do we have vaccination for all these 5 hepatitis? Second, you talked about immunization and vaccinations and how we can eradicate through vaccinations. So do actually the vaccination card, the plan of a newborn baby, when the baby is born, they get in 2 months, 3 months, and every month they have scheduled some vaccines. So does that also include the hepatitis
Yes,
vaccines?
yes, it does include hepatitis B. In fact, it is part of the national schedule, and now there are new 5-in-1 pentavalent vaccines have come, which include it again diphtheria, whatever, measles. So all these vaccines are part of the national schedule, and the cards are given. Even for adults, you will have 016 schedule is available, and the vaccine, especially healthcare workers, should get their antibody done, not rest of the population. That is done. Now, hepatitis C, since you asked, does not have a vaccine.
Okay.
B has a vaccine, A has a vaccine,
No.
but not C. It's a difficult RNA virus like corona.
Yeah.
It was so difficult, but that was a global calamity, so people developed. Now they are working on a mRNA vaccine for C. But C, the good part is that it is generally quiet and the treatable, curable. The bad part is that people are not aware. Like for example, people got cesarean sections, they got hysterectomy, or they got a prostate surgery long ago. Now they are coming with advanced liver disease due to hepatitis C or a cancer due to hepatitis C. So one more time, anybody who has got a surgery or a procedure done, anytime I would say don't worry about 99 or 2005, do get your hepatitis C test. If it is the RNA is positive, get treated on that. The hepatitis A vaccine is given in all the countries, developed countries, but in India generally the kids have hepatitis A by food and water, so they are already immunized. Hepatitis A, the immunity is lifelong. आपको एक बार हो गया, बचपन में जॉन्डिस था, हाँ भाई अब नहीं होगा, वो हेपेटाइटिस ए था, उसकी एंटीबॉडीज़ रहती हैं. But now wealth is there in India everywhere, so they all carry their bottles and they don't drink, and the hygiene theory. I would say hepatitis A vaccine in those who are somewhat middle, high, upper middle or rich class, they should get the vaccine done. Foreigners, travelers, they get hepatitis A vaccine. Hepatitis E vaccine is not there, so we have to be careful that in winters and other things we have good, proper, high, potable, good drinking water, and food is not exposed and handled by poor people. So you protect.
I think those are very handy tips which we can take with us.
Okay.
So, and what are the options available for people who are diagnosed with hepatitis B and C? The treatments available. Like you said, कि A के लिए we all are immunized by our birth if a person gets that, and B के लिए we also have, but C is something.
Yeah, see, the drugs are available.
Yeah.
And there are two drugs, sofosbuvir and valpatasavir. It comes as or declatasavir. These are the drugs. They are given in the national program also, at least sof and decla. And by taking that, your 90% chance of getting rid of the virus. And the drugs are not expensive. India has some of the cheapest, the best generic medication pharmacy. And hepatitis B drugs are tenofovir, TAF and entecavir. These drugs are available, and they are generics are very cheap. In fact, India exports to every country, and they are safe. So all these drugs are generally safe. But I would say we do see in a given week, and in India the liver cancers due to B and C are still a problem. If patient has cirrhosis, he needs a treatment for liver disease with a specialist care. And if there is a cancer, then also specialist care. Sometimes you require transplant for B and C, which is readily done, very successful programs. So I think those who have an advanced disease are treated in a specialized center, but our aim is early detection, early screening, and treating them early enough and preventing those by proper vaccination. If we take these steps clearly, and policies which are very clear are adopted by all stakeholders, whether you are drug user or dialysis groups and others, I think we can prevent. Hepatitis C we should be able to eliminate, maybe if not 2030, within the next few years or so. But those who are hidden, the biggest problem is where are those people?
हाँ,
खोज के निकालना है उनको.
So, going ahead we have come to the end of this awareness program. I want to know your views, your hopes, and aspirations for the future of hepatitis care and management, both in India and globally. You just told us, diagnosing them, making them people identify who are they, treating them, eradicating it. But the aspirations ahead for that.
Yeah, actually, hepatitis B treatment has been complicated by doctors. They make guidelines whom to treat and whom not to treat. This guy has fibrosis, so he should be treated. His DNA is high, he should be treated. His liver has inflammation, like his SGPT is high, he should be treated. Others are just watched, because they know that out of 100 people, maybe 10 will have disease. So they want to treat the disease. They do not want to treat the infected.
Okay.
But my opinion is different. And my opinion is that the infected will give the infection to others. And every year, several lakhs of new hepatitis B are detected. Infected. So, in my opinion, all infected and all diseased, all of them should be treated. So, my approach is from treat select to treat all.
Yeah.
And this I have been proposing for last 4 years or so, and I am happy to say that the Chinese associations have moved a little bit that side. WHO has moved a little towards this side. In my feeling, my aspiration is by 2030 globally, like HIV, where we treat all, we will treat all for hepatitis B. We treat all hepatitis C. We don't isolate. You have the virus but no disease. We treat whether you have infected or infected plus diseased. In hepatitis B also, we should treat the infected and anybody who is hepatitis B positive and those who are diseased both together, so that the pool of infected and the pool who are carrying the virus to transmit it to the others disappears. If we take this policy, we will require 65 years more or 70 years more to get rid of hepatitis. By end of this century, we can, because all newborns will be protected.
Yes.
And all infected will be treated, and average age of Indian is 70 years.
Yes.
So you require a complete new generation of Indians who are free of hepatitis B. They are living without fear of B or C.
And then there is no scope of hepatitis.
Yes, no scope. You are immunized, you are vaccinated, finished. Okay?
That's great, sir. Thank you so much, Dr. Sarin, for your valuable insights, your contribution you have made to this campaign of public awareness on the occasion of World Hepatitis Day. It matters a lot because all these tips, treatment options, future plans are coming from the expert of this field. So thanks a lot for your time and your valuable insights, sir. It matters a lot.
Thank you, Simran, and thank you, Shreyas, both of you, for coming here. And it's a pleasure. I hope through you the message goes, and if there is something wrong which I have said, get back to me and say, Doc, you are wrong here. Doc, you should improve. I am ready, but I am committed.
Sure, sir.
Thank you.
Thanks a lot, sir. Thank you.